Okay. It's 9 o'clock. I'd like to call the August 13th Crow Wing County Board of Commissioners together for the regular meeting. Please stand for the Pledge of Allegiance and a moment of silence.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and
It's 9
justice
o'clock.
for
I'd
all.
like to call the August 13th Crow Wing County Board of Commissioners together for the regular meeting. Please stand for the Pledge of Allegiance and a moment of silence. We have open forum. Is there anybody here who would like to speak? Whether you're written in or on the agenda, is there anybody that has sent? Okay. Anybody here? Seeing none, we will go on to review and approve of minutes for the regular board meeting on 7/23.
Motion to approve.
Second.
We have a motion by Franzine, seconded by Coring. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Hearing none, motion carries. I'll get this right one of these days. Then we'll go on to review and approve the agenda. Any additions or deletions to the agenda?
Nothing.
Motion to approve the agenda for today.
Second.
Motion by Coring, seconded by Franzine. Any discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed, same sign. Hearing none, motion carries. Consent agenda.
Mr. Chair, I got a question on 5.6, if we could get a little County Road 133, an explanation of what's,
Good morning, Mr. Chair and Commissioners.
Good morning.
My name is Daria Groutman, and I am an engineer with the Highway Department, and I am also the project manager for the in-slope repair that's going on County Road 133. So it's going to be roughly a 170-foot-long project by Sunset Lake. It's on the south side. And so that slope is basically falling in. So what we are proposing to do is a trench, probably 10 feet into the water, do a 1-foot trench, fill it back in with boulders, and then from there bring the slope so that we can get a 1 to 3 slope, which is more manageable than the slope that's falling in right now. So we don't plan on doing any pavement repairs, and so it'll just be the in-slope repair.
so there won't be pavement improvements, or,
Nope,
so, okay, so you don't have to tear up the pavement that's there for this fix?
correct.
Okay,
Yep.
perfect, all right. That's it.
Okay,
Thank you.
Yep.
thank you. I had one on, I think it was 510 or 511, and it was in regards to, I know we do a grant for, let's say, $1,000 or something like that per entity, and I see we're changing that a little bit. The only question I have is in those, is that if it's in a jurisdiction or something, is there anything where the jurisdiction has some skin in the game? You know, let's say the city, I'll just use the city of Jenkins as an example. Let's say we ask for that and we have $500 worth of stuff to send down, and it's approved by the land services to do that. Then the city gets that $500. The city didn't have any skin in the game at all. It isn't like the city picks up half and the county land services picks up the other half.
Good morning, Chair, Commissioners. That's correct. Up to $1,000, we would reimburse that city
Okay, so
with no match.
there's no match. I just think about that maybe in situations like that, because we are cleaning up that jurisdiction, or that jurisdiction's looking at getting cleaned up, that they should have some skin in the game in those instead of it all being on the county, because it is also their jurisdiction. That was just the only comment I really had on that. I just wanted to bring it up. I didn't know how the other board members feel on that.
Mr. Chair, all I can say is it was discussed at Solid Waste, and the committee recommended to leave it as is. It has been in the past.
Okay, okay. That was the only question I had for that.
Okay.
Any other questions for consent?
If not, motion to approve.
We have a
Second.
motion. Do we have a second?
Second.
Motion by Franzine, second by Hoag. All in favor signify by saying aye.
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 Opposed, same sign. Hearing none, motion carries. Community Services.
Morning, Mr. Chair, Commissioners.
Good morning.
I am bringing forward today some funding requests from the Blade Opioid Coalition. The coalition met on July 26th to discuss the funding requests that are listed in the RBA. And I will start with the $8,000 requested by the Brainerd Fire Department. That is for a Pulse Point subscription. Pulse Point is an app that's designed to, as it says here, be a force multiplier when it comes to someone in need of CPR. Everyone who's signed up for Pulse Point gets a notification if there's a need for CPR somewhere in their location, and then folks can come to the scene if they need to. Brainerd Fire Department uses this, but a number of agencies, including the Sheriff's Office, are involved in this subscription as well. So all of Crow Wing County first responders are a part of this. They would like to use it not only for the CPR notification, but to push out opioid education, so education on opioid overdoses, for example. And so it's $4,000 per year, and this would fund 2 years of the system, or the subscription. We would look at paying out, though, the full $8,000 at one time, so we don't have to keep track of the $4,000 each year. That's the first one. Any questions on this one?
So would that, if they have an app, it'd be like on their phone or whatever, and it would beep them and tell them that there's somebody requiring it, or just?
Yep, someone in need of CPR that's nearby. The chief did show what it looks like, and it's a regular app with a map, and then there's a pinged location that they would respond to.
Would show where
if need
that's
be.
at? Okay.
Mr. Chair, Kara, did they have any discussion about how they would pay for that subscription going forward after these 2 years?
So normally, they're able to get grant funding and/or donations. And so utilizing the dollars for the next 2 years will help them potentially build that fund for donations for ongoing expenses.
So they've used it in the past, though,
Correct, through mainly donation funding and grants.
so they've had that opportunity to build the fund previously.
Yep, and with any donation, sometimes it runs a little drier than others. So Chief was hoping that we could help them out to fund this for a couple of years.
And this is used throughout the county?
Yep,
So are all the, you say it's a force multiplier. Does that mean all the other fire departments are utilizing this also?
that's my understanding. Fire departments, ambulance personnel, law enforcement, all sorts of. All first responders. Thank you. Yep, all first responders.
And when you say first responders, are we talking about the people that are out there that are trained as first responders, not?
That's correct. It just doesn't go to anybody. It just goes to the first responders, those that are trained and be able to react or respond to a call that comes in. It's, matter of fact, it goes.
Got to come to the microphone.
Yeah, you need to come to the mic.
Oh, sorry. It's for all first responders. So anybody that's a first responder is on this, gets this app, and they get it downloaded to their phone. It's interesting. I'm in dispatch, and I get the notification on my phone before it even goes out to anybody. So I get it immediately.
So, are you done?
Go ahead, I'll see if I want.
So, Mr. Chair, so this isn't necessarily to do with an overdose. This is if somebody needs CPR or?
So it could be potentially. Currently, it's only for CPR related, which can be tied to overdoses because they would need CPR. But mainly, they would like to provide opioid education through this app as well. So that's how it ties in mainly, is that educational piece.
So, Mr. Chair, so you think that it goes by the rules that we're, I mean, we can't be paving roads with opioid dollars. This isn't too far astray from that, you don't think?
Nope, and so we have a discussion of all the professionals on the coalition, and the coalition decided that it's in line with the work that we're trying to do in terms of supporting first responders.
Mr. Chair, Director, you said all first responders, so that's every fire department that's,
Yep, ambulance, all those trained as first responders.
so if we do the 8,000 for Brainerd, are we just opening up for a flood of other applications for?
Well, like Commissioner Coring, that's a very good question, Commissioner Hoag.
I always have a lot of good
1-0.
questions.
So Brainerd Fire Department hosts the information, so they host it all for all of the first responders in the county.
Okay.
Mr. Chair, so Kara, each agency does not have their own licensing
Correct.
situation. The amount that we're talking about here would cover the Pulse Point subscription for the Brainerd Fire Department to support it for all of Crow Wing County's first responders.
Yep,
So it includes everybody.
yep.
Good. Thank you.
Okay, number 2, $100,000 to the Crow Wing County Sheriff's Office to help fund the jail medical program. Initially, the jail had brought forward funding the entire medical program, around $280,000. The coalition had a discussion around that. It would be a one-time funding source, and so it's probably not the best use of opioid dollars to fund the budget for 1 year. In addition, there are dollars that are allocated for jail funding as opposed to funding some other maybe nonprofits or programs that might not have funding related to opioids specifically. And then you can see we have other sheriff's office requests in here as well. And so we're trying to be mindful of how much we allocate to ensure we still have some. This money has to last us for 18 years, so, and we're not quite sure how much we're going to be getting ongoing. So if you have questions, I assume the sheriff can answer on that piece.
Go ahead.
Mr. Chair, so just another question to have you on the record, that you feel that you're telling us now that you feel like this falls into the parameters of what we're supposed to be spending the opioid dollars are, just in case some auditor comes in and looks at it and says, no, that wasn't the intent. So I just want you to be on record of saying that you believe that this falls in that basket.
So two things to your question, Commissioner. The Opioid Coalition believes it falls under the basket. I do not believe it's a good use of opioid dollars, but I am not the overall keeper of the opioid dollars. The coalition makes those decisions. I think it's money going towards the budget for a one-time use, and I don't think that's a good use. So do I personally agree with it? No. Does the coalition think it is a good use of dollars? Yes.
So then, Mr. Chair, so to put the sheriff on the spot, what does the sheriff think?
I think we have the coalition in place to make those decisions, and I think it's a good use of the money to be used for what's outlined there in front of you. So the coalition made the decision that it's a good use, and I agree 100% with that.
Okay.
Mr. Chair, don't go away, Sheriff. So what I'm looking at and what I struggle with is that we've had a medical program in the jail for a long time. In 23, the one company goes bankrupt, and we had to start picking that up. We had a relationship with Essentia, and so we've always funded that under the levy. And so I'm wondering why all of a sudden we would need an additional $100,000 to support this program. If you could just explain that to me.
For the
The $100,000 for the jail medical. Initially, the request.
I wasn't at that meeting, I'm sorry about that.
Initially, the request came in to fund the full jail medical program, the $280,000.
Got to get up to the mic.
Initially, the request came in to fund the full jail program of $280,000. And since the jail health program is mandated and we have to cover that regardless, and we have covered it regardless over the years, the coalition felt that, and 280,000 is a pretty big chunk of change when we're talking about our opioid dollars. So the coalition decided that we could potentially fund up to $100,000 for the jail medical and not the full 280,000.
So my question, though, is, Sheriff, in '23, we would have been doing our '24 budget, current year, and those expenses would have been built into that levy at that point. And now we're being asked for another $100,000 or $280,000, doesn't matter which number you want to use, in addition to what was already in the budget. I don't understand that.
And so it would be for the 2025 budget to help offset some of the jail medical expenses. So as you know, we're in the middle of working through our budget for Crow Wing County overall, and this would help to offset some of the jail medical expenses.
Wouldn't that be a discussion held at the SMT level as part of the levy negotiation that takes place?
It could be if that's what you would direct us to do, but because it's through the opioid coalition, just like these other requests, it was brought forward that way. And Chief Deputy Bradley had brought it forward as a consideration, and I bring all considerations to the coalition regardless of who and where it's from, so.
I understand that, and I'm not questioning it. I'm just questioning why, when we already have a budget and we know we have to supply that medical program over there, why all of a sudden we would look at this pot of money, the opiate dollars, as a resource to fund something that we've always funded through our levy process. That's
Mr. Chair?
my position.
I think maybe what I'm hearing is there was looking at some creative ways to help offset some of the reduced revenue that we were seeing in the jail. Obviously, we had some reduced expenses that were already incurred with closing of the 2 pods there for 2025. The sheriff's office has been looking to try to find ways to help either boost revenues or reduce expenses. Is this a way to reduce expense and boost revenue? You could look at it that way. It's an off-levy funding source that would be there. My concern is, I also share what Commissioner Barrows is saying, is this is a one-time infusion that would happen for 2025. In 2026, you're going to be back to the situation where you have to fill that gap of that $100,000 now already as well. So it is a Band-Aid fix, and I think it would be something that should be looked at in context of the full budget proposal that's being brought to the county board for them to consider. And I think it is definitely something that you could agree to fund this $100,000 for 2025. That does help offset some of that issue, gives the sheriff's office opportunity to maybe dig up some additional revenues, which I know that the sheriff has some other processes in place that would replace some of that lost revenue. So it could be a stopgap measure that you're looking at to help fill that need for 1 year. You have some options to look at it. I think it's very important you recognize it is a one-time spend for an ongoing expense. So when that funding would go away in 2025, if the sheriff hasn't found additional revenues to fill that expense, you now have basically $200,000 on levy that you have to fund for 2026. So just having those parameters in place to recognize what that would be.
So,
And then-
Mr. Chair, oh, go ahead.
And then just to expound on that, I guess where I'm coming from is, you know, the opioid settlement dollars, the way I understand it, and I could be wrong, but I thought that was meant to be for prevention, you know, ads, you know, whatever it be, to try to help people to, you know, get into recovery or whatever have you. And this, you know, with all due respect to the opioid group, I don't even know who that is, but I just don't think this falls into that basket, to me. I don't know, it doesn't make
If you
Doesn't make any sense.
if you come during med pass out, everybody is standing in line for meds. So I think it does fall under that.
And these people are addicts, or they're possibly addicts?
Yeah, if you come during med pass out and you see how many people are in line, it's the whole cell block, the whole pod.
And Commissioner, you are right in that it is, the opioid dollars are for prevention. There's really 4 buckets. So it's the prevention, it's the assisting in training, it's to help with kids and families who might be struggling with opioids, as well as adults, and it's that whole treatment piece to help fund. So, and there aren't a lot of really restrictive rules on the ways in which we fund different programs or the programs that we do fund. For the jail, I think, obviously, the jail medical program is not only statutorily required, but it's also, they're really trying to do some things in the jail that really help with folks who are facing addiction and substance misuse. But where I struggle with it is because it's a one-time funding source for an ongoing budgeted need. That's where I don't think that it's the best use of opioid dollars.
So this is, of course, another one of my dumb questions. Am I on the opioid coalition? Okay, that's what I thought. 'Cause
So you don't know who's on it yet, Paul?
yeah, so now I can see that I need to, I get the emails, and I guess I didn't even know I was on there, but I can see that I have to bring my strong personality there
Great.
to weigh in and be the voice of reason, or at least a voice on the other side. I'm trying to be kinder and gentler. I know Rosemary doesn't like that, but
Well, and you and I would have been on the same side, Commissioner, because this is one that I don't agree with.
does this have to have action today?
You can allocate today, or you can approve potential allocation. The money is paid through the opioid funding, which Community Services holds. We can pause on it until we have a communication with SMT around the budget, if you'd prefer.
I will say that the coalition meets regularly,
Right.
and they're really invested into it. I'm not on that committee myself, but I know that they spend a great deal amount of time at these meetings discussing this stuff. So I think to be respectful to them and their
Yeah.
time, that's what they're bringing forward.
So
One more thing, and then I'm done on this issue, is if we vote on it today, I'm probably going to be a no. But I just don't think the stew is cooked on this yet. I think if you come back and give me some more reasons why, I probably could get there, but I'm not convinced today, so I think it needs to have a little more cooking of the stew. That makes sense?
Yep, absolutely. Mr. Chair, one quick question. When you say passing out meds, what are those meds for? Are they related to opioid?
Names of them?
I don't know the names of the specific meds, but everything related to substances. The jail has implemented a new medical assistance therapy, MAT program, in which they're trying to help folks with addiction issues to get stabilized and then out into the community, and then we help get them into treatment through community services. So there are all sorts of different meds. It could even be acetaminophen if they have a headache. So it's
So
everything.
that not all of it's related to opioid?
No, sir. Okay. Should
I have just a couple things now. I remember when I took the tour through the jail and was talking to the doctor was talking about the software that would have been nice to have there in order to connect to the clinic, because we didn't have that type of software, and I didn't know if this was part of that or not.
Nope, that was an additional $100,000 that you approved at the last time I brought opioid funding.
Okay.
Opioid funding request. That is for an electronic medical records system in the jail. Troy was having discussions with Essentia. We were finding that program was very specific. They had found a potential other program that St. Louis County is using that could do something similar.
Okay.
and I have not been a part of that discussion recently. Do you know any
I have,
updates?
yeah,
Go
yeah.
ahead, sir.
No, yeah, we're looking at this other program that'll do everything that we need it to do, and that it'll be able to speak to folks at Essentia, so
But
they
that
can-
wasn't part of this 100,000?
No,
Okay.
it wasn't.
The other one I have is, are we the final say on that, or is there some overseer that'll come in and say, boy, you know what, I really didn't like that, we're gonna cross that off, and then we have to scramble to find that 100,000?
So the state allocates our portion of the federal opioid dollars with the outline of the requirements in which to spend the funding. I can send that to you guys again. It's a memorandum of understanding through the Attorney General. I do not believe anyone will come forward saying you couldn't spend your $100,000 this way. They're really leaving it up to the community. We will need to report on how we spend the money, obviously, but I don't see anyone coming back for dollars related to that. We can tie it into opioid funding and trying to help prevent substance misuse, treat substance misuse, and then get them out into the community with treatment.
Yeah, I'm okay to pass it, I just don't want somebody coming in afterwards and say, oh, well, we're gonna cross that off, and you gotta add that back to your
Yep,
levy.
absolutely.
No, the other program, the other EMR stuff, medical records it'll be a lot cheaper than the 200,000 that they were gonna charge us. And it's got a bunch of stuff that we'll never use, so.
Any other questions? or
Mr. Chair, yes, more questions.
comment? Okay.
The same one?
Nope, going to move on to the next item,
Yes.
Oh, okay.
Okay.
which is the,
Which you might as well stay here, too.
might as well stay there,
Number
Sheriff.
3, yeah. So $9,288.37 to the jail for replacement of 2 medication pass carts and 1 mood medication pass cart. That mood program is the substance misuse program that I had just mentioned. So that's more of a specialized cart that they would take around, and their medication pass carts need replacing as well.
So, realizing you're not on the, I'm inclined to take these items from the Sheriff's Department and even perhaps the Bridges of Hope, because we talk about a year-round shelter. I don't know, and you can speak to this, Carib, since you're a city council member over there, but be sure and wear your county hat while you're here, since the mayor has an issue with that. Have they approved a year-round shelter?
The city of Brainerd?
Right.
No, sir.
Okay. So I'm inclined to table those items until we get somebody from the coalition that can come here and talk more in detail and how they identified the opiate issue as being the one that drives these numbers. That would be where so instead of, Sheriff, going over these others, respecting that you aren't on that commission, that we look at these and get more information regarding them. The first one, I don't have a problem with the Brainerd Fire Department and the subscription, but I think we need people here who can talk more definitively about why or how the relationship is with the opiate dollars.
So I can explain the discussions that we had in the coalition meetings, but I am not the one bringing those requests forward, if that's what you're...
Well, I would back up. So similar to the $100,000, when I look at med carts, they potentially wear out, but that would be part, again, of our ongoing budget to fund that program. And so using opiate dollars, it's one-off. They're going to wear out again, and then what happens at that point? And when I look at the MOUD medication pass card, I'm not familiar with that one, so I don't know what kind of cart that is. But if it's a replacement, we're in the same boat again, that it's, or if we're buying a new one, that's never been in existence before.
Yeah.
That's a different discussion that I would have. But ongoing expenses, to me, don't relate to opiate dollars in some of these cases.
The MOUD program is new in the jail, and so that would be, this medication pass cart is new, specific to that program. The other 2 carts are the replacements.
Okay. So then, I'm going to just express myself on the next item, which is the $19,309 for the LATED team. The secure storage, the DROBO, I'm assuming that's an acronym, for storage drive for the phone dumps. and Sheriff, you probably can answer this one, and I'm being respectful, I mean.
Yep.
So we've had that all along, I would assume, or have we not?
Well, we've had a couple of different phone options that we use to dump phones. And one phone dump will be, or one, like Cellbrite will be the main one at this time because they did all the updates. And then the other one's not as good. And then they do a new update that then is better than the Cellbrite one. So they're just, they're different programs, and we're looking for funding for those like Cellbrite and those, for this one, Drobel.
Okay, and part of that 19,000 is 14,000 for insurance for the LATED program, which I would assume we've always had insurance on our LATED program, no?
No, we actually didn't, and we just started that, and that's one of the things that we were trying to fix and trying to get more organized on this for the LATED team. For us to get insurance, we have to have insurance on, for the LATED team. So, and that's for 5 members.
Could you tell me what the LATED team is?
That's the Lakes Area Drug Investigative Division.
Okay.
So we have a number of different operatives that are on there from other agencies as well. So they're under this special licensing.
So this would be the first time we would have insurance, though?
Yes, yeah. Well, this is going to be the, was this the first year or second year? I think it's the second year.
So if it's the second year, then it's already been built into the budget that we passed last year for the 24 year, correct?
Was it? I'm not sure if it was or not. I guess it would have been.
Right.
Yeah.
So I'm going to make a motion
Yeah.
to table
Yeah.
all of these items except number 1.
Mr. Chair?
Yes.
I do have Dan Eckstead on Teams, and he has his hand up, so I'm assuming he wants to say something.
If he's more than welcome to.
Are you going to withdraw your motion?
I'll
'Cause that's
hold- I'll hold
Once
it.
you make
Hold
that motion, we can't talk about it anymore.
All right, I'll withdraw for the time being.
Go ahead, Dan.
Good morning, Commissioners. I just wanted to speak to the insurance piece of it. That portion actually has been funded through our forfeiture, our related forfeiture piece, for the past 2 years, and we're looking to, for 2025, fund it through this opioid funding piece of it. Just for the fact that the related dollars are primarily, or they are all funded through the forfeiture piece of it, which is right now running a little, it's lower than what it has been in the past. So this piece would help out tremendously.
So, Mr. Chair, so Dan, what is the amount that's in that account?
I'll just ballpark it. It's probably right around 40,000 right now.
And the follow-up question then is, if you would receive the 14,309, what would you be using those other dollars for instead of paying for insurance?
It would be additional operating expenses.
Okay. So, anything else, Dan?
Nope, not at this time.
All right, I'm going to make my motion. Oh, I'm sorry.
Just
I'll
before you
back
do
away
that,
from my
I just
motion.
want to say that this has to go back, and I actually would like it to go also on these items that Commissioner Barrows talked about, back to the senior management team, because Debbie, this is more, I should say county administrator, this is a bigger issue because this creates more of a problem in the budget in the future down the road. And so I think it needs to be flushed out more at senior management and flushed out more if it meets in line with the opioid settlement.
Yeah.
So I'm ready to.
Rosemary, do you have any?
Now, item number 5 doesn't deal with our budget, but $200,000 for Bridges of Hope to assist in the shelter and remaining open all year. If the city of Brainerd hasn't discussed this, I think that's premature.
So, Mr. Chair, if I might make my motion at this time, and if there's no other discussion, I would make the motion to approve item number 1, which is the $8,000 per year for 2 years for the Brainerd Fire Department for the Pulse Point subscription, and table for further discussion items 2, 3, 4, and 5.
To a time, I would second that. Is that a time certain? Is it the next board meeting?
Until the next board meeting.
Okay.
Yes.
I would second that motion.
Okay, we have a motion and a second. I would ask for any more discussion, but I
That's
think
just
we've had plenty.
non-debatable. It's
I don't
not
think it's
debatable.
necessary.
It's not debatable.
Yep, and all in favor signify by saying aye.
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 Aye. Opposed, same sign. Hearing none, motion carries.
Mr. Chair, question for clarification.
Yes.
So at the next board meeting, would you like me to bring the MOU from the State Attorney General, so you can review that and see if it's in line as you guys deem it to be? That's what we go by in the coalition meeting, and so you were saying you wanted to ensure that it was in line with the opioid funding rules?
Could you send
I'll
that
send it
to
to you
us?
guys, yes.
Yeah, email it to
Just
us. If
email
we
it
get
to
it
us.
at the meeting, it's too
Yeah,
late.
So we'd have time to read it, yeah, that'd be great.
And, Mr. Chair, and so Chief Deputy Bradley should be here to address some of the Sheriff's Department concerns, and somebody from Bridges to talk, and maybe, I don't want you wearing your city hat, so somebody from the city should be here to, I don't know if it would be City Administrator Royals or someone else, to talk about the bridges, or Jana from
Yeah,
Bridges.
it probably would be better with Jana. The city, as far as I know, has not been approached to amend the conditional use permit
Okay.
for a year-round shelter. I think Bridges was waiting more to hear more about a potential funding source, to see about remaining open throughout the course of the year. And then I will just add, I can add you all onto the opioid coalition meeting invite, and if need be, we can make it a public meeting, and anyone who wants to attend can. During those meetings, we have set up kind of our game plan of how we're going to proceed with funding different programs and dollars. We have significant discussion around each of the funding requests, as well as what's going right, what isn't, within the community. And then also we're working on developing a dashboard for the public, so they can see where the dollars are being allocated as well. So that's a work in progress too. So I'll include you all on the invite heretofore.
Thank you.
Thank you.
Thank you so much. On to land services. Chris?
Good morning, Mr. Chair, Commissioners. I have 2 items for your consideration this morning. Item 7.1 is the preliminary plat of Barbour Road Estates. Is the property owner. The preliminary plat is titled Barbour Road Townhomes. This is located in Section 26 of the First Assessment District. If we can maybe go down to that survey. There we go. So this was an outlot that was platted as part of the plat of the Barbour Road Estates a few years ago off of Barbour Road. This is off of Piper Lane, and so the plan was, when that was platted, was that this outlot A would then would be platted down the road. And so we have received that application now, and so the preliminary plat of Barbour Road Townhomes is a total of 15 lots, consisting of 14 lots for townhomes, for creating 7 duplexes with 1 outlot. And what you'll see up here, this is located on parcel number 99260746. And so if they were to come in and plat this, as you see in the neighborhood where they've got 2.5 acre zoning, they would be able to get approximately 7 lots in here. And what they're proposing to do is to put duplexes, because a duplex is a permitted use on a lot of record that meets the 2.5 acre zoning requirement. And so their request is to be able to plat these 14 lots out there, and then have the common open space have an outlot. So this will have a homeowners association. You'll see the blocks towards the back here are the septic systems proposed for each one of the units. This was considered by the Planning Commission Board of Adjustment at their meeting on July 18th of 2024. And based on the finding of fact that was submitted that night, the application, the staff report, the on-site conducted on July 2nd, along with public testimony, the board recommended approval of the preliminary plat of Barberwood Townhomes with 15 total lots. Unless there's any questions for me, I would recommend approval as well.
Mr. Chair,
Yes.
Chris, just so I can wrap my head around where this is at, Barbie Road, is that the road that's right before, if you're going north on 371, it's right before Crowing Power and to the left?
Correct.
And then just go down, and then I would run right into this, right?
Correct. Yeah, I do have a map that shows the approximate location of this. I don't know, Teresa, if you want to put that.
Is this from your email or
From
the
the email,
packet?
from the email, yeah. Just to give you an idea of where it's located.
This is
That one or the other
Unorganized,
one?
yep, correct.
Organized, okay.
Yeah, unorganized, yep. So down you've got County Road 77 here, 371 as you head north. This is Barbeau here. You can see Piper Lane is that one coming down here to the south. And so we're talking the plat, the piece, this is Outlot A, that is to the west of the.
The blue
current plat.
thing is
Yep.
where you're at? Okay.
Correct.
Okay.
Can you bring that other map back, the one of them that you had there that showed the townhomes, and then it showed those little 4 blocks that are behind each of the townhomes? What are those?
Those are the locations of the septic systems, so there's,
That's-
each of these has an alternate and a primary, so these units here, this would be their septic, and then, so each of the townhomes, the duplex would share a septic system, so.
That's what I was just wondering. So they're sharing septic, they're not each of them having their own septic and well?
No.
They're doing some common septic and well?
Absolutely,
Okay,
yes,
okay.
absolutely. Yep.
I'll make the motion to approve.
I'll second that motion.
We have a motion seconded. All in favor signify by saying aye.
Aye.
Opposed, same sign. Hearing none, motion carries.
Thank you. Next item we have on the agenda is another preliminary plat. The title of the plat is Olden's Landing. The owner of the property is MD Investments LLC. This is located in Section 30 of Center Township. It's on Bass Lake, which is a recreational development lake. And what they're proposing to do is, with Olden's Landing, is to create 7 lots. And this is a replat from the homestead plat that was established in 2000. The parcel numbers in question on this are 533-00527, 533-00528, and 533-00529. And so these are the lots in question here. If I can find my pointer, there we go. There it is. These are the lots that are here. The old, if we can go down to the 2, I think it's 2 slides down, Therese. And then, yep, this, if you could zoom in on that where it says the homestead.
One more down.
There we go. Thank you very much. So this is off of Homestead Road. This is Rebel Road over here. This is just a little south and a little east of Lake Edward. And so this was platted back in 2000. You see the lots here. And what was unique about this is that they platted these lots here without lake access, and they platted this lot here coming down and then had this dog leg over like this. And so the replat of this gives, shortens, puts the lots together and gives the lots all access to Bass Lake. So if we could go back to the original, the new plat up top. There we go. So now you can see with the way that this has been reorganized that you've got, these are the lots now that have lake access here. Then you have lot 7 and 6, where you can see the lot lines here they do not have, but these are the lots that do. So it just straightened out the getting everybody, appropriate lake access compared to the way that it was before. So it's just just a replat of that plat from 2000. Now, this was considered by the Planning Commission on July 18th of 2024. They discussed all the findings of fact, the application that was submitted, staff report, the on-site of July 2nd, public testimony, and all information received on the survey, and recommend approval of the preliminary plat of Olden's Landing with 7 lots. If there's any questions, I'd be happy to answer them. Otherwise, I would recommend approval.
Question, bass, is this the lake that they call Turkey Bass? I mean, I don't want to,
That's a good question. I think this also goes along as turkey bass as well.
I think I've
Yeah.
heard it called Turkey Bass. I don't know if
Yep.
people call it that. So it's the one right past Clow,
Yes,
stamping on the
correct.
right-hand side.
It's on, it'd be on the east side of Clow, correct. It's gonna be it's on kind of on the south side.
I think why it was called Turkey Bass is because there used to be a lot of turkey barns
Correct.
at one
And
time.
there still are some of the remnants there on that side of, over on that side of the lake, so, yep.
Mr. Chair, Chris, do all of these lots have a building area that will honor the setbacks that we normally have?
Absolutely.
And the septic systems?
Absolutely, yes, they will.
Right?
Yep.
So there shouldn't be a need for variances on these
Nope.
lots?
No, there will not be.
Okay.
I was just going to go ahead and make a motion for approval.
Okay.
Go ahead.
Motion for approval.
We have a motion by Hoag,
I would second that motion.
seconded by Coring. All in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries.
Thank you.
Thank you. Next, we have county engineer.
Good morning, Mr. Chair and Commissioners. I have one item for you, but before I get to that, I'd like to take the opportunity to recognize somebody that's helped us over the last 3 years. In the crowd, you see Jonathan Andreessen. Jonathan is a NDSU student studying civil engineering, and he's helped us out over the last 3 summers, and this is his last week with us. He'll be going back as a senior to NDSU starting next week. And I just want to publicly recognize him for his contributions and kind of list off some of the things that he's helped us accomplish over the last 3 years. As you know, we built a lot of things, a lot of roundabouts and stuff, and he's participated in all of those in each one of your districts. And I'll just quickly read off some of them. The County Road 45 bridge rehab down in your district, Commissioner Coring. The Beaver Dam Road roundabout at Wise Road and County Road 5. That was in 22. In 23, he began to help us out on County Road 115 on the south side and was very instrumental in working with us there. The roundabout in 3 and 11 south of Cross Lake, he was very helpful there. And then in Doug's district, the 210-31 roundabout by the new grocery store. And then in this year, he's been working hard to help us finish up the rest of County Road 115 in Nashway. He worked hard on the 3 and 4 roundabout in Lake Edward Township that just opened up. And right up to his last day, he will continue to help us in Cross Lake in that 3 and 66 roundabout. So he's helped us out a lot, and he's gained a lot of valuable experience working out on the road, building this project, and I think that will serve him well as he transitions from being a student into, full-time position. And unfortunately, we don't have an opening for him, but I want you to always keep us in mind, Jonathan, because it just never know when we have an opening. So I want to, again, just publicly thank you. Thank you very much, and good luck in your senior year.
Jonathan, do you find that your working here with the county helped you? I mean, when you go up to class, you can sit there and say, hey, I was on the road. This is how it's done. This is how it's not done. Tell the professors how it's supposed to be done, right? Yeah, sometime. Well, I have family up in Fargo, so go Bison,
Mr. Chair, I might say he's still got a week left, so he's not telling us the truth. So we'd like you to come back when you're fully done, and then you can tell us how it is to work for.
Thank you for your service for us.
And if I could say something, if you ever get offered a job from Sourcewell, let us know, and we'll take over here. We'll create a job for you.
Oh, boy.
So we're under search for our next civil engineering seasonal worker. He's been back through the last 3 years, and the last 2 years, I believe, you've been by yourself. And so we've had a good run of having multiple years, and that's the value. He can come and hit the ground running, or he's been able to come hit the ground running the last 2 years. And so we're on the search for that next person that will take your spot. So we'll be advertising for that. maybe in January of next year. The item that I have for you is to award a contract for intersection lighting. In accordance with, we're very focused on providing safe roadways, and particularly in rural intersections, and we have for years been installing rural intersection lighting to provide not only the light, but also to indicate to drivers that the environment is changing. So I have identified 18 sites where we are going to install overhead rural intersection lighting, and there's a list there in your packet. It spans, again, every district. And we have been successful receiving federal funding to do this. It's federal safety improvement dollars, and that funds these installations up to 90%. If you recall back to the last board meeting, this is the item that was pulled from the agenda because we had opened bids, and the bids we received are about 75% over the engineer's estimate. And what we wanted to do is, before asking you to award the bid and then agree that the county pay the difference, we wanted an opportunity to go back and seek the additional federal funding to get it back up to 90% of the actual bid. And we were successful in doing that. Over the last 2 weeks, we were able to find another $162,000, which funds the new bid item up to 90%. And so the county's portion only went up $26,000. So we were able to, I'm happy to report we were able to do that, and that little delay in pulling it off the agenda, we were able to find that money. So today I'm asking for the board action as a recommendation to authorize entering into a contract between Design Electric and Crow Wing County for the amount of $468,277 for the project to install these lights at 18 locations.
So a question, Mr. Chair.
Sure.
So I just had a vision when you were saying we found, I almost visualized like somebody was dusting and they said, oh my Lord, here's $160,000. So where did you find that money? I mean, it certainly wasn't while you were dusting.
No, that's a great question,
I know it
Commissioner
is.
Coring.
Of course, Paul.
So there's a larger pot of federal highway safety improvement project dollars around that's allocated throughout the state. And so when those projects are identified and those partners around the state are having bid letting, some are over the estimate and some are under the estimate. And so fortunately, in another district, in another part of the state, they had been allocated more federal funding than the actual bids came in. It's the exact opposite. So when that happens, we have an opportunity to work with our state aid engineer and our team that manages the federal funds to look if there's any of that around the state. And so I don't know exactly where it was, which project it was, but they had extra federal money for this program, and we just talked to our partners at MnDOT. They found that $162,000 for us that was previously allocated to another project and brought it to us. And so that's just a testament to the strong relationship we have with MnDOT and how they can really help us out. It was $162,000 that it would have been a tough decision to ask you to award a bid that came in 75% over what the engineer's estimate was. So.
Well, I commend you. That was great. I'm going to actually send Sheriff Klang down to Hennepin County to get the extra money that the commissioners are going to pay themselves to bring that up here to help us with our budget. So we're going to make sure that they don't get $188,000 a year. That's absolutely ridiculous. I never heard of
They pulled it
that.
off the table.
Huh?
They pulled it off the table.
Oh, they did?
Yeah.
Oh, thank God.
So just to get back on track here a little bit, you still show on this estimate that I have in front of me, you still show it being 85% over with design. The one, am I looking at the wrong one? That one there?
No, that's always going to be the same.
That was the actual, it's still over the estimate. The bid award was well, the awards today, but we opened the bids over 2 weeks ago. So it's
Okay.
still over the engineer's estimate, but we're able to now.
Find that other,
We're able to find the money that we can afford that bid that was 75 or 85% over.
and all these lights will be LED, will they be, what they call light pollution? Because they're gonna be out in rural areas, they're gonna light the intersection, but not light the whole night sky.
They're going to be the standard lights that we use.
Okay.
And they'll be drawing attention to these intersections
Yep.
and signaling to the drivers that the environment is changing. So they are LED, yes.
The cost, do we have an idea what the cost of operation of those lights? Because I think we did have a meeting once where we talked about the county picking up those power costs last year. Do we know what those costs are going to be for the ongoing power for these lights in those intersections?
Commissioner Lubke, we will be paying this in accordance with the direction that I received from the county board about paying the cost of electricity for these intersections throughout.
Yep.
We will. On average, it's about $17 a month per light.
Okay.
So it's a hefty bill, but it's worth it the trade-off for that, to provide the safety for the residents and our guests of Crow Wing County is certainly a good trade-off in my opinion.
Yeah, just want to know, there was some cost, there is some cost ongoing for the county in
There is a
regards
cost.
to lighting.
There's a cost, but there's also a benefit as well.
Okay, that's all I had.
Okay.
Mr. Chair, if there is no other discussion, I would make the motion to authorize entering into a contract between Design Electric and Crow Wing County, followed by the amount of 400.
Motion by Barrow, second by Coring. All in favor signify by saying aye.
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 Opposed, same sign. Hearing none, motion carries.
Thank you.
Thank you. County Sheriff, I think we have up next. You might as well just camped up here,
Right, exactly. Well, good morning, I guess, already. We've had a very active, busy summer, and if you guys are out and about today or on your way home, you want to stop by, we're doing some training down at the fairgrounds, some taser training, some firearms training, so if you want to stop in there and see the guys, say hi to them, and see what we do down there for our training, that'd be okay.
After our earlier discussion, you'd like to take the taser to us?
Yes, exactly.
What I'm hearing?
It's called a surprise. So come on down.
Yeah, no thanks.
I'll bring my taser along.
Yeah, we've actually, it's been a good summer so far. We haven't had a lot of, fatalities or so it's been good that way. We've also been very active with our drug enforcement guys, making some good busts and good seizures and taking some guys off the street. So that's been good. I've been on the road talking about our records management system that we're looking at doing, or we're vetting out a couple of different systems. We've kind of narrowed it down to maybe one in particular, and we got some demos that are going to be coming up here in the next couple of months. Things have really changed. We've had this records management system for the last 17 years. It's really outdated itself, and we're looking at updating and going to this new records management system that'll be pretty, very, very different and very beneficial to not only us, but to you as well, as having that dashboard, that 35,000-foot view of what's going on just, from the night before to several days before, so.
So, Mr. Chair, a question on that subject. Commissioner Hoag and I had a discussion. Commissioner Hoag was talking to some of his city council people over in Deerwood that you went and talked to them. And I don't know, Doug, I don't want to put words in your mouth, but I think we kind of want to know. I think Commissioner Hoag said it was like $15,000 for the city of Deerwood. That's a lot of money to that tiny little town.
Yeah.
And can you just explain how that works?
Yeah, so currently they're all roughly paying around like $3,000, $3,000 to $4,000, and it's going to go up quite significantly. This new system, you got to remember, we paid like $1.2 million for this thing back 17 years ago, And now you fast forward 17 years, we can't even get the same system for that amount of money today. So our yearly maintenance contract with the current system that we have is right around $255,000. This one is going to be $500,000 a year, so $500,000 just for the maintenance contract alone on this. So my point to going to the councils and is to let them know that, hey, we need to start preparing for it. We're not going to have this same luxury of having, paying only $3,000 a year on a maintenance contract. It's going to be going up, and I wanted to give them a heads up on it. It'll probably be, 2 years out. We have some initiative funding or grant funding for these different agencies that they've already applied for, and actually they are already going to receive that. So in reality for them, it's not going to cost anything, but I don't know how long that's going to last, that grant funding stuff. So I want them to be thinking about that, to be putting money aside so that they can pay for that.
Mr. Chair, may I
Yes,
just add one
yes.
thing? At your last budget committee meeting, the proposal and the funding and the project that Sheriff Kling is talking about was on the agenda for discussion for you to get an update on the funding of that and those collaborative efforts that are going on. Unfortunately, with some staff illness that day, we weren't able to cover that particular item with you, but it will be on your agenda for the August 22nd Budget Committee,
Okay.
where you will hear an update of that program, of that proposal, and some of the funding sources that will be looked at there.
Okay. So, are you done?
Yes.
Okay, so another question, if I may, Mr. Chair. So I read in our great Brainerd Dispatch, which I do read periodically, there was a story that was quite troubling to me about some of our great deputies were down at the Wild Rice Depot, and there was a guy down there that they had to tackle him, and he tried to get a hold of their gun. Could you just tell about that? Because I think these liberal judges are just slapping these people on the hand. And I mean, this guy was, if he'd have got a hold, am I reading that wrong?
Yes,
Did I read it
yes.
wrong? Can you just explain
No.
what happened down there?
Yeah, we had this guy has he's struggling with some mental health stuff.
Okay.
He was in the military and served over in Iraq, and
Okay.
he's a young guy. He's when he's on his meds and he's not mixing it with other addictions that he has. He's actually he's a good dude.
Okay.
But in this case, he wasn't on his medications. He was using marijuana, and he was totally out of control. And yeah, he did try to grab one of our deputies' guns. And actually, it was a call that came into the Wild Rice Depot that this guy was acting strangely and behaving inappropriately. So our officers went down there, and we've had dealings with him before, so we knew that it was going to be a fight with him, which it was.
So I just, yeah, obviously I see that the guy needs some help, but that could have been, when I read that article, I just thought this could have turned out really, really bad. If you
Yeah.
got a hold of that.
Right.
gun, I don't know. I don't know. I
It
just
probably
feel like
took him a
these
week to
judges.
stabilize once we had him in custody.
Pardon me?
It took a week to stabilize him with his meds.
Oh, wow.
Before, and he wouldn't take them in the beginning, and he thought we were trying to poison him and all sorts of different things, but we finally were able to talk him into taking them.
Well, thank God it turned out the way it did, but I look at what he was sentenced, and it just, I don't know. Obviously, we need to try to help that gentleman, but, well, I don't know. Could have been bad. I don't know.
Yeah, we're working. We've had so many mental health calls of late. I mean, we go through these things twice a week, and we look at the calls of something like that, or we talk about the mental health calls, and the mental health calls always outweigh all the other calls that we have. And we're really thankful for our embedded social workers, Sherry Whitworth and Tara Kowalczyk. They do a great job. We're actually going to be assigning one deputy to that co-response team so that they can utilize each other for co-responding. So getting that person the right help that they need. And having a one go-to person, not just for the sheriff's office, but for the whole county. So other agencies will be able to contact that deputy and say, hey, I got this guy, and we keep having these calls with them and stuff so they can hopefully get these people the help that they need quicker and will be able to respond to their needs quicker.
So, Mr. Chair, can I ask Commissioner Barrows, would you accept the question?
Sure.
Because you worked in mental health. I guess it's, I've never worked in it, so I don't know, but this is a great example of somebody that's, if somebody's on their meds, they're great people, everything's perfect, but I know this from a personal incident for me with some family that somebody goes, I feel fine, I don't need any medication, and then they quit taking the medications, they really take a nosedive.
Mm-hmm.
Law enforcement or somebody's called out there, you get them back on their medication, they're good again, goes a ways, then they go, I feel great, I don't need any medication. What do? I mean, is that just the cycle that continually happens? I don't know how you could ever fix that.
It certainly depends, and thank you for the question. It's a great question, Commissioner Coring.
Thank you.
Depends on how chronically ill they are.
Yeah.
But your point is well taken. It is a revolving door
Yeah.
situation. And it's a couple different things that can impact individuals. First of all, those medications have side effects, so
Right.
you think of, they go outside, they can get sunburned in a matter of minutes. A lot of it is, a lot of those medications are predicated on making an individual just lethargic. So you don't have any energy, you're laying around, you're eating, you're gaining weight. There's nothing to cause you to want to get out of bed in the morning. If you've ever tasted some of those drugs, you would see why they wouldn't want to take some of them, more in the liquid form than in the pill form. And then there's the cost that goes with it too. So sometimes if they're, self-paying that will eliminate them from taking their meds. They just don't have the money to do it. And they do deteriorate, just like you said, and it becomes a dangerous situation when you go out there and handle them. The sheriff's department, the police departments were always the ones who brought them to the state hospital. They handle them initially, and usually those individuals don't like uniforms, and they don't like guns, because it's a threat to them. And they're hearing voices, they're hearing things, a lot of them that aren't real, and cause them to act out. But it is, and they seem to have sometimes strength that the normal person wouldn't have.
Correct.
So it's a challenge for public safety to have to deal with these individuals, but to have them in jail is simply wrong. And the protocol when they come in generally was that if they weren't willing to take the meds, if you prompted them and they weren't going to take them, you then went for a doctor's order to do a shot, and then you went to liquids, and then you went to pills. And to the sheriff's point, it takes a week to get them stabilized. So you're going to deal with all these behaviors in the cell blocks now that used to be out here at the state hospital.
Right.
And with individuals that aren't experiencing that, and the deputies that are trying to handle the whole situation over there, it's just not a good situation. And, the state walked away from the old state hospitals, and that has proven to be a terrible direction to go. So thank you for the question. And
the support, their support network is very limited as well. They don't have the support that to help them stay focused on those meds. But those calls take a great deal of time from us.
Right.
And it's not something that you can just handle and go on to the next one. I mean, they're labor-intensive calls with those folks, which is understandable.
You always hope, Commissioner Coring, that in a DHS approach, that you not only get them stabilized, but you start to help them, educate them in hope that they will not quit taking their medications. But that has a small return on effort also, but it, you know, that is part of what DHS does. It isn't just sticking a needle in them and getting them stabilized and putting them out, and that's the approach that we're using now with our jails. Is we get them stabilized, we push them back out in the community, they deteriorate, and the officers have to go and handle that situation again. So it's,
We have been doing some good work in there, in the jail though, and doing follow-ups with these folks once they get out of jail. You know, the average stay for somebody in our jail is like 20 days. And so it's not a long time. It's generally like 14 days or 10 days, and they're in and out of the jail very, very quickly. So once we get them stabilized, then we try to follow up with them when they're out, to call them up and say, hey, don't forget about your doctor's appointment. And so that's one of the things that Anna, Sherry, and Tara do. And by just calling them up and confirming, hey, make sure you make your appointment, and staying in touch with them. So that's been, again, although it's labor intensive, that might be the only support network that they have.
that's right, that's right.
Right. Okay, so, thank you.
Yeah, thank you very much. Appreciate
Thank you,
it.
Sheriff.
Thank you, Sheriff. County Attorney?
Good morning, everyone. I don't have anything for you today, but I certainly can answer any questions.
Anybody on the, oops.
Mr. Chair, I do have just a question. Don, just on the conversation that we were just having, do you feel like, I don't know, I don't mean to put you on the spot, but
Since when?
yeah, I know. Well, I'm trying to be polite.
Thank you.
But, you know, I know each case is different, but somehow I feel like some of this stuff is, people are getting a slap on the hand, you know, on some things. Judges are just, do judges, here's my question is, do judges go along with your recommendations most of the time, or do they reduce it down to even something even lesser?
Well, I can answer that two different ways. When you say reduce it down to even lesser, that could be the level of the offense from a felony to, say, a gross misdemeanor, or it could be reducing the amount of jail time or the severity of the sentence. In regards to reducing the level of severity of the charge, most of the times the bench doesn't do that unless it's an open-ended agreement that might go there. In regards to dispositions, the court normally go with what is worked out. If there's an agreed upon disposition, if there's not, and it's left to the court's discretion, I would say most of the time that they would listen to the prosecution side over the defense, but not all the time, and sometimes they do, in the exercise of their independent discretion, exercise something that we may not agree with, but obviously we respect that because that's the system and that's their authority.
Okay. Mr. Chair, I'm in the process of watching Netflix on Suits on Netflix. I don't know if you ever watched Suits. It's a lawyer,
I've seen it.
It's a lawyer program, and I don't know if it's anything like what you're doing or what lawyers do, but it sure seems like a lot of deal making. You know.
I would love to have a photographic memory so that everything I saw, I would always remember everything and never have to go back and relook at stuff. But the older I get, the more I realize that's not the case.
Yeah. Anyway.
Is there anything else for the county attorney?
No, there's not.
Okay. Thank you.
All right, have a good day, everyone.
Yep.
Thanks.
County administrator.
Mr. Chair, Commissioners, we had a senior management team meeting on Monday. A couple of things that we talked about was our IT manager was present and reviewed our cyber training statistics with us as far as those folks who are completing their annual cybersecurity training and the semi-annual training that we have. We have a couple of different training programs that we're asking folks to complete, and I'm happy to report there's only about 4 or 5 folks countywide who have not completed that training yet at this point in time. So we've really done a great job of getting all of our staff to be aware of completing that training. We also looked at our statistics for those who are most likely to click on those phishing test emails that are coming through. That is an ongoing process that will continue, and we know that there are bad actors out there who are trying to find any way that they can to try to infiltrate into different organizations. So encouraging everyone to continue to review with scrutiny when those emails come in before clicking on or opening any of those attachments. That training will continue to be ongoing as well. While we still had Jason in the room, we took advantage to also discuss looking at some of our new policies that we're putting in place, namely the shutdown policy that we've started to implement following the CrowdStrike situation that we had a couple of weeks ago. If all of our PCs would have been offline at the time that that was pushed out, we would not have had anybody who got the blue screen of death. So we're looking at some ways to make sure that we can ensure all of our computers are getting shut down on a timely basis, and looking at some discussions around our software application inventory audit to see if there are any of those services that we're currently purchasing that maybe the cost of the software is outweighing the service or the value that we are getting from those systems. So like even in our personal lives, I think somebody had mentioned that you often subscribe to multiple levels of Netflix if you're watching Suits, or if you have different services that you're not using. We want to take that scrub view to all of our systems as well. A couple of other things that we talked about at SMT yesterday. We did look at our LEAD program, which is our high potential leaders that we see within our organization, to try to reinvigorate that program a little bit. It's kind of been on a hiatus since the last cohort went through in 2019 with COVID, and then with standing everything back up again to be getting us back to the position of where we are. We think it's time now to really reinvigorate that program. So we're taking a look at who are those leaders within our departments that we should identify to go through that process, and also, do we need to make some tweaks to the different modules that we had within that? This is a completely staff-driven, staff-presented training for the most part. We have very little where we actually have one session where we do some outside consulting around our insights profiles, but for the most part, we're using our senior management team members, our other staff folks who have gone through this training before, to give those presentations and freshen that information up a little bit as we look to reignite that yet this fall. And then finally, we did also continue our discussion on the 2025 budget. You will be seeing a recommendation from senior management at your budget committee meeting next Thursday on the 22nd. So we'll continue to work through that process as we get to that piece as well. My second item that I have on the agenda today is to take action with regard to you as the Town Board of Unorganized Territory of First Assessment. We have received a petition to vacate part of Maple Drive that is now known as Elm Drive in the Ojibwa Park community plat. This is bounded on the west and east by the west and east lot lines of Lot 22. This is a dead-end road that is basically ending in a person's property, and they have now petitioned to vacate the road that has not been used anyway. It's just one of those platted road situations. We did receive petitions, signatures have been verified, staff comments have been received, and the petition was accepted by the County Administrator's Office on August 8th. You, as the county board, must now set a date to hold a public hearing with regard to this vacation petition, and we are recommending that the public hearing date be set for September 10th at 9:15 a.m. So the action that we have before you is that acting as the Town Board for Unorganized Territory, to schedule a public hearing for September 10th, 2024 at 9:15 a.m. for the petition to vacate part of Maple Drive, Elm Drive in Unorganized Territory First Assessment District.
Mr. Chair, would move the request for board action to set the public hearing for a petition to vacate Maple Drive, known as Elm Drive.
Second.
We have a motion from Coring, seconded by Franzine. All in favor signify by saying aye.
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 All opposed, same sign. Motion carries.
Mr. Chair, that's the last I had on my report, but I'm happy to answer any questions if anyone has any.
Mr. Chair, just a comment on the report. I'm happy to report that I have finished my training as it relates to IT. The IT manager was after me to finish the training. I have completed it, and believe it or not, it only took me one try to complete it, so I'm very proud of that.
Well.
It was on emails in case Renee Richardson sends me a trick email, I will know not to open it up. And so I'm happy to report on that.
Well, thank you.
Yes, you're
Commissioner Coring. I mean, if we need to get a little award for you, we could get one made
Yeah.
up. I'm sure Therese would be more than
All
happy
good.
to do
The
that.
rest of us do it without announcing it.
Mr. Chair, if there's nothing else, I would make the motion to adjourn.
Motion.
Mr. Chair, if I could interrupt for 1 second, I had my hand up there.
Oh, I didn't see you.
I just wanted to brag a little bit because part of that report was the top 20 clickers in Crow Wing County getting caught by the IT department. Only one department had a 0% attendance on that list, and happened to be the county attorney's office. So I just thought I should give my people kudos.
We need another plaque then.
Don't need a plaque, just want to brag a little.
Thank you.
Thank you.
Okay, with that,
I make the motion to adjourn.
Second.
motion made and seconded. All in favor signify by saying aye.
Aye.
Aye.